I ensure that the room is safe as I approach my patients. I try to provide privacy by drawing the curtain. Then I perform my hand hygiene following WHO standard of hand hygiene. I apply an ample of gel on my hand. I rub my hand palm to the back of my hands with fingers interlaced, palm to palm with fingers interlaced, back of the fingers with fingers interlocked, tips of the fingers, rotation of the thumb, and my wrist. I wait for 30 minutes for my hands to dry. Then I approach my patients. Hello, good afternoon. My name is Joy. I'm your attending nurse for today. And I'm your community nurse sent here today, and I'm here to carry out some assessments on you as well as to ask you some questions regarding activities of daily living. Is that okay by you?
That's all right. Welcome, nurse.
Thank you very much. Can you please tell me your full name and your date of birth as I compare it with what I have on my documents here?
I'm Snow White, and my date of birth is 2 of the 2nd, 1960.
All right, I've confirmed I'm with the right patients. How would you like me to address you, please?
You can call me White.
Oh, that's fine, White. Okay, that's good. White, do you have any allergy?
Yes, I'm allergic to latex.
Oh, I'm sorry to hear that. And what type of reaction do you normally get anytime you come in contact with latex?
I do have anaphylaxis.
Oh, anaphylaxis reaction. So sorry. I just want to assure you that throughout my care, I'm not going to use latex on you, okay?
Okay, nurse. Thank
All right,
you.
White. Have you been resting for the past 30 minutes?
Yeah, I've been in bed for about 2 hours now.
All right, that's good to hear. Can you see and can you hear me well?
Yes, I can.
All right, are you comfortable at the moment? Is this position okay for you?
That position. Yeah, it's okay, but I've got some pain on my left leg.
Your left leg, I'm so sorry. If I ask you to rate your pain from 0 to 10, 0 means no pain and 10 being the highest level of pain, what score are you going to give it?
I will say 5.
Oh, I'm so sorry to hear that. Can I quickly put a pillow under your leg? Is that all right?
That's all right. Go ahead, nurse.
Okay, and I can also teach you some deep breathing exercise that might also help you. And if you don't mind, after the assessment, I will go and check if you are due for any painkiller. I mean any analgesic, and I will come back to administer it to you. Okay.
Okay, nurse. Thank
All
you.
right. Thank you very much. So I will leave you for now to quickly go and gather the materials I'm going to use. In case you have any concern, just give me a shout. Okay.
Okay, nurse. Thank
All right,
you.
as I leave my patient side, I perform my hand hygiene, then I go and put on my apron as well as my gloves. Assuming I've put on my apron and I've drawn my gloves as well. Assessor, can you please confirm to me that this apparatus has been calibrated within the last 24 hours according to us policy?
Yes, please.
All right, thank you. So I move the apparatus close to my patient side and I perform my hand hygiene again. Hello, White. I'm back. Are you still happy for me to continue with the procedure?
Yes, go ahead, nurse.
All right, so I will be starting with your blood pressure. If you don't mind, I will be making use of your right hand. Is that okay by you?
Go ahead. Thank you.
All right, I can see that the hand is not swollen. There's no sign of inflammation or infection. There is no cannula on it. I'm happy to use the arm. And I have ensured that I have the right cuff for my patient. So I will be attaching the cuff round about my patient's arm now. Not too loose, not too tight. About 2 cm above the antecubital fossa. And while that is measuring, I'm going to get my tympanic thermometer, attach a new probe cover to it. And White, can I make use of your right ear to check your temperature, please?
Yes, you can. Go
All
ahead,
right,
nurse.
I can see that the hair is not having any hearing aid on, and there is no purulent discharge, no sign of inflammation. I'm happy to use this here. I insert my thermometer, tympanic thermometer. Now it has beeped. That means that it has beeped. That means bleed. That means that the temperature is taken. So I'm going to discard the probe cover inside the clinical waste bin after taking note of the reading. And I unwrap the cuff. White, I can see that your leg is already uncrossed. I just want to cut your pulse rate now, okay? Can you please try to remain quiet for the next 2 minutes?
Okay, nurse.
All right. We'll be making use of your right wrist. Is that all right by you?
It's okay.
Okay. I'm counting now. All right. Assuming 2 minutes have passed, So, White, I actually counted your pulse rate for 1 full minute, taking note of the rhythm, the pattern, and the regularity of your pulse. And I as well counted your heart rate for another 1 full minute, taking note of the rising and the fall of your chest. I'm sorry I didn't inform you earlier that I will be counting your respiration, and I mean your respiration. And that means that's because I did not want the reading to be altered. I'm so sorry. Is that okay?
That's all right.
All right, so I'm done with your observations. I will just quickly step aside now to plot the observations on the community observation charts. In case you have any concern, just give me a shout. I just step aside and I perform my hand hygiene again. Then I plot my observations. Plotting my observations, and I can see that there is another form here that accompany the community observation charts. That is the PHQ9 form, the Patient Health Questionnaire form that has been pre-filled. So I'm going to calculate the total score. Okay, I'm done with all that. I go back to my patient. I perform my hand hygiene again. Hello, White. I'm back. Are you all right?
I'm all right. Welcome back, nurse.
All right, good to hear. So I'm back, and your observations, they are all within normal range. Okay. However, I can see that there is a form called the Patient Health Questionnaire Form, that's PHQ9 form, and it has already been filled. Can you please confirm to me that you were the one that filled this form?
Yes, I feel the earlier, nurse.
Oh, all right. Okay. I've calculated the total score, and the total score is 15. That means that you are having major depression, although moderately severe, and the treatment recommendation is antidepressants or psychotherapy. So I will be escalating it to your GP, okay? And I will be referring to
Okay.
the therapists for further plan of care. Is that all right?
That's all right, nurse.
This is the PHQ9 form, and this is where to find the interpretation of the score. My patient scored 15, and that means that my patient is having major depression, although moderately severe, and the treatment recommendation is there as well. So, back to the form, White, that you feel, I can see you have higher score in some of the questions here. You have higher score in trouble falling asleep, staying asleep, or sleeping too much. Can you tell me which one are you experiencing? Is it trouble falling asleep, staying asleep, or sleeping too much?
I can't remember the last time I had a good sleep.
Oh, I'm so sorry to hear that. I just want to encourage you that anytime you want to sleep, you should try as much as possible to maintain a quiet environment, also to dim the lights, okay? And if you don't mind, we can offer you a sleeping pack that we just use to cover your face anytime you want to sleep. You can also take a warm bath. You can take a warm drink at bedtime. And if you don't mind as well, I will be referring you to a sleep therapist for further plan of care, all right?
Okay, nurse.
All right, you also have higher score under poor appetite or overeating. Which one are you experiencing?
Ah, I can't even eat, nurse. I
Oh,
don't know what to do. I can't. The appetite is just not there.
oh,
I
no
don't know.
appetite. I'm so sorry to hear that. I would just encourage you that you should try and take small meals at frequent intervals, okay? And I will be escalating it to your GP as well if they won't mind placing you on some medication that will help to boost your appetite. And if you don't mind, I will be referring you to a dietitian for further plan of care. Is that all right?
That's all right. Thank you, nurse.
Uh, any other concern for me? Any other concern? Is there anything bothering you that you would like me to know, that you would like to discuss with me?
Oh, no, you've done enough. Thank you.
All right. I will also advise you that you should try to participate in community group activities. Okay, it will help to elevate your mood, to take your mind off things that might be bothering you. All right, and
Okay.
I don't. Based on other activities of daily living question, I don't know if you have any other concern. Maybe your elimination. Do you have any problem with your elimination? Elimination.
No, no, don't
All right.
worry.
All right, that's good to hear. So, Snow, I will be leaving you for now, okay? In case, I believe you have your GP number with you.
Oh, yes, I
All right.
do.
In case you have any further questions or concern, you can ring your GP. And if you have a case that you feel is life-threatening, just call emergency number 111 or 999. Okay? Thank you very
Okay.
much, White, for your participation.
Thank you, nurse.
All right, I'm going to leave you for now. Bye. Then I
Bye.
perform my hand hygiene, my final hand hygiene again. And that is the head.